We use neurologic music therapy to enhance respiratory function, articulation, word finding, and word naming, while also improving speech rhythm and prosody to some extent. So it is very helpful. And I like this quote too: the synergistic use of melody, rhythm, tonality, harmony, and other musical elements to jointly activate music processing areas in the right hemisphere, while also rewiring areas of speech control in the left hemisphere. We'll go into that a bit more. So I also wanted to say, besides this neurologic training that we have, we are also trained to be person-centered holistic treatment. And we do want to have personally relevant and meaningful goals, because the more meaningful the goals are, the more engaged and the more the brain changes. So we do target all these domains, not just speech, but my e-guide does target speech mostly. So communication, both verbal and nonverbal. There's a lot we can do nonverbally through music therapy exchange. Social and emotional functioning, cognitive functioning, we can do specific neurologic music therapy techniques for building attention, memory, learning, executive functioning, etc. We also can work on motor skills. So we have gait rehab, which is called rhythmic auditory stimulation. So using rhythm for gait rehab has been really very effective for stroke rehab and for Parkinson's, etc. We do also target fine motor and upper body coordination. So I'm not going to read all this, but just wanted you to see neurologic music therapy is a specialized training. And the definition they give is the therapeutic application of music to cognitive, sensory, and motor dysfunctions. And it's based on this neuroscience model of music perception and production. It is recently recognized by the World Federation of Neurologic Rehabilitation and the European Federation and the International Society for Clinical Neuromusicology. So for NMT and speech and language goals, we mentioned this before, but we have these standardized techniques and evidence-based interventions to really help with breath support, word retrieval, word fluency, articulation, voicing volume, voice inflection, and nonverbal expressive communication. So I actually do work with all these populations mentioned here, people not only with aphasia, but also other neurodegenerative diseases like Parkinson's, dementia, and I also have a private practice with people on the spectrum and with developmental issues. So it's broad. And I wanted to just emphasize that I collaborate a lot with speech therapists. I know we have a lot of speech therapists here today. So it's just the best way to go, I think. So here's one of the just kind of the underlying theses of this music and language overlap, called the opera hypothesis. And this is by Patel, who is a cognitive psychologist, neuroscientist, and he wrote this book, Music, Language, and the Brain. If you haven't seen that one, it's a good one to check out. So basically, we have this adaptive plasticity in our networks, our speech processing networks, because we have overlap. There's this overlap in the brain networks that process both speech and music. We have precision. Music places higher demands on these networks than does speech in terms of precision of processing. We have emotion. So the musical activities elicit the strong positive emotion, which helps us engage, which helps brain change. Repetition, the musical activities that engage this network are frequently repeated. Lots of songs repeat their choruses over and over. It's a great way to work on that skill. Attention, the musical activities that engage this network are associated with focused attention. So this is a great hypothesis. Basically that, since speech shares these networks with music, the speech processing benefits. So besides speech, I just want to mention the social and emotional part of it. Music therapy is a great place to feel successful, to develop a new self-concept post your traumatic brain injury or whatever happened. It's a great place to feel empowered, to find a new sense of self. There's also a way to link your past self to your present self through various activities. Baker's research was a songwriting experience where they wrote songs that represented their past self and present self and future self. So some very creative ways to work with social and emotional skills. And we know music's proven an antidepressant to improve mood, motivation, anxiety. The emotional engagement we mentioned is super important. Strategies also for relaxation, which, most people with aphasia do have some anxiety or depression. So there's all these strategies as well. And the social participation part of it is huge. So I've had clients who do recordings of songs for special events like weddings, and the choir, of course, we'll talk about later. So we have some research highlights. This is a meta-analysis done in 2022, and that was basically, they had about 115 people involved in all these studies that they pulled together for the meta-analysis. And they did find that music therapy can improve functional communication, repetition, and naming in patients with post-stroke aphasia, but did not see significant improvement in comprehension. However, this next study is very interesting, showing that sung melody enhances verbal learning and recall after stroke. So the song stories were learned and recalled significantly better than a spoken story at the 6 months post-stroke stage, especially in patients with mild aphasia. So when this information was presented verbally but sung, it was learned and recalled significantly better. So the comprehension part is there in this study. Then the most recent meta-analysis that I just mentioned was in 2024, came out of China, and it was specifically on neurologic music therapy techniques, which we'll talk about soon. And they found the significant part was just improving repetition ability. There were 11 studies that they could use. They used all these randomized controlled trials. We need more studies, but they did have a pretty good number of 329 people. And then I think this is the last one I have here, is just listening to vocal music as opposed to instrumental music or audiobooks right after a stroke really helped with increasing gray matter volume in the left temporal area and functional connectivity. So I think that's important to know. All right, so we've talked a little bit about the social element. So there are these aphasia choirs all over the world. If you don't know the Aphasia Choirs Go Global Facebook group, check it out. It's a great, a huge number of aphasia choirs that are available all over the world. So we know that, communication difficulties cause this lack of confidence in social situations and more isolation. So singing in the choir can have a positive effect. In a therapeutic choir, they're usually led by music therapists or speech therapists, or combination. And it did show in Tamplin's research that there was increased confidence, a positive effect on mood, and established peer networks. So that's huge. There's new research that just came out in April of this year, where they actually did the MRIs to show that there was the structural neuroplasticity going on due to the singing groups. So this was 28 people they studied with mild non-fluent aphasia. And after 4 months of this group singing intervention, they saw gray matter and white matter changes in the left frontal language-related structures, but also in the right hemisphere, which correlated with improved naming abilities. So it's so nice to see what us, as music therapists have seen for many, many years, this increase, and now we can see it in the MRIs. Okay, so here is a list of, not all, but some of the neurologic music therapy techniques for speech with people with aphasia. The first biggie is the melodic intonation therapy, which is used by speech therapists as well as music therapists. Our training in it is just a little bit modified from the original. We tend to make it more melodic and rhythmic, which I guess it's our thought that it will use more of those right musical parts of the brain, the more musical it is. So the second one is MuStim, which is musical speech stimulation. And I'll show you some of that in the e-guide. Therapeutic singing is big, and it has to be designed correctly. You need to get the song that has the right words that we need to repeat, So I think it is helpful to sing. It's also helpful to have a music therapist guide you in what to sing. And then the next one is rhythmic speech cueing, which is really helpful for any motor dysfunctions of speech. So basically, you are tapping each syllable as you speak and making somewhat of a little interaction with the rhythm. That is super helpful. So the VIT is vocal intonation therapy, which I'll show you in the e-guide as well. A lot of good warm-ups and things to work on articulation as well as the volume and the tone of your voice. And this last one, symbolic communication training through music. This one has been used. I found one case study for global aphasia in this, and it's really helpful in those nonverbal stages, using basically what it says, using music symbolically, nonverbally to go back and forth with instruments and drums. And it's a very improvisational type of music therapy there. Okay, a little bit more on the melodic intonation therapy. This does engage both hemispheres, and it may reduce dependence on the left hemisphere by using language-capable regions of the right. We also see research that it helps motor speech issues like apraxia, in addition to aphasia. And this is a great article here. The NMT training, as I said, puts a little more emphasis on melody and memorability. Oh, and here I have a video. This is a client using the Sing for Speech e-program, the part with an MIT phrase, melodic intonation therapy phrase. Okay, let's try just the notes. We're going to just listen first. Okay, your turn. La, 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 la. Good. One more time. La, 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 la. Very nice. Now step 2. Remember to tap your left hand. We're going to listen first. Good, let's hear it. How are you today? Very nice. We would do that 10 times, but I think you've got it. Let's try it one more time. Step 3, we'll take turns. So I'll go first and then you say it. Okay, listen.
How are you? How are you today?
Yeah, so that was a Zoom session that I held with him. And he just finished a 5-week case study on using this program. And he used it every day, about 30 minutes, which is remarkable in itself that he was using it every day. And he really made some improvements. So I designed this program to be a supplement to music and speech therapy and to use in between. So you can get that repetition to use in between sessions, because we know brain change can't happen just once a week if you do your session once a week. So that was my goal in this, and he's been doing it. So it's been nice to see. Oops, let's see. Let's go to the next slide here. Just real briefly, this type of exercise, this melodic intonation therapy, can help restructure this part of your brain, the arcuate fasciculus. And this is the area that's damaged for non-fluent aphasias and Broca's. And it's also a larger and more complex part in singers. So there's some interesting facts there. Another one of the neurologic music therapy techniques is called MuStim, musical speech stimulation. So we use this just basically to fill in the blank of a song at the very end. You are my sunshine, my only. And the music, the rhythm, the melody, the memory of it can stimulate speech to fill this in. This is also included in my e-guide, so I'll show you that. And there is, as I mentioned, the Sing for Speech e-program is available on my website here. It's in a aphasia-friendly format. It's interactive with video and audio. And I'll give you a tour here. Here's a couple of quotes really quickly. So we have this daughter of the client with severe apraxia and aphasia, who we just saw. He has very severe apraxia and typically can only say thank you. And yet he does sing full songs. And so we've carried this over to his everyday speech. So they thought that was a very user-friendly experience, and her dad found it very intuitive, and he was able to navigate in it by himself entirely. So that's great. He was motivated to build a daily practice with it, and he even made his own daily checklist after he ran out of the photocopies of the checklist that's included. He spent about 30 minutes a day, and she noticed that he really articulated very well following the exercises, and was trying to remember and invoke that rhythm and intonation from the ebook or the e-guide. And this program is also being used with other populations, and this is with a client that I have who has developmental differences, and he's an adult and he lives in a group home. And I just got this feedback from the staff at the group home that he has been using it, and it's a preferred activity, and he's singing alongside staff, which is huge. To have these group home staff interacting in this way is so meaningful. He was able to say, I need a break now, using that melodic intonation therapy, like the program shows them how to. And this is actually a song that we wrote using some of the melodic intonation phrases, and then we compiled them into a song. So that's a fun experience and a different way to incorporate these music therapy techniques into a creative product like this.